Okay, so we're talking about health screening for men. I think this is something very important that most people don't do, and which we should be doing at some stage of our life. Okay, so today's talk is quite informal. So the objectives are a few. So after the end of the talk, I would expect that we know a little bit about what is health screening, especially for men. Um, what are actually the benefits of health screening? Yeah, some people say, "Oh, I don't want to do my medical checkup because I don't want to find out lah that I have this or I have that. What's the point of me finding out? It'll just cause me more problems." But that's beside the case. Yeah. So what does health screening actually involve? People think that all it involves is just some tests, um, the doctor saying you're fine and that's it. But actually, it's a lot more than that. You can actually achieve a lot more with regards to medical checkup or health screening than you think you can. Okay. A regular point that is asked to me often is who should go for health screening? Yeah. Is it for everybody? Does everybody go for it? Or do you need to get sick before you go for your medical checkup? Or who actually goes here? Yeah. And also, how often should you do your medical checkup or your health screening? Okay. Um, it so happens that I'm a preventative doctor, and medical checkups are usually maybe 50 to 60% of my work. Okay, so most of the most of the time I do a lot of medical checkup, and most of my patients come to me every year to do their medical. So I have a good pool of patients who are in fact now friends who comes to do their medical checkup with me every year. Okay, so what is health screening? Health screening is actually a process. Yeah, so it's not a one thing event. It's actually a process to evaluate the health status and potential or risk of an individual to develop a disease or condition. Okay, so after health screening, the doctor should be able to tell you, hey, you are at risk of developing this or developing that. So you better be careful. Okay, so that is part of why you need to do it. And I think the second point is very important. It should be personalized to each individual, not one size fits all. Um, if you just Google health screening in Malaysia, what the first thing you'll see is hospitals, um, flyers, and advertisement to say, oh, this you can get this health screening or this medical checkup for so and so price. You can get this package for so and so price. You can get this package for so and so price. That's like buying things off the rack, actually. Yeah. Actually, health screening should be personalized to each individual. So, because sometimes those packages are good, but you might be missing something that you need to do. Or on the other hand, you could also be doing a test that you actually don't need. Okay. So, personalizing it would be, or tailor your medical checkup would be the best thing to do. But not many places offer this. Yeah. So again, why do you need to do health screening? Okay, why is it important? It allows early detection of diseases. I think this is one of the most important thing. Yeah, which is unknown to the individual. This can be like diabetes, high blood pressure, cholesterol. Yeah, and even to some degree cancer. Yeah, these things are what we call silent killers. You don't really know you have them until you go for a medical checkup, you go for a health screening, and then these things are found. And the good thing about these things are you need to catch them very early, because if you don't, then the problem is harder to solve, and that can bring you a lot more complications. Okay. Now, even if your medical checkup or your health screening results come back okay, there is always room for you to be healthier, right? Um, if you do it properly, the doctors, if they find that your blood test, everything else is normal, then he or she should also advise you on how to make that better. Okay, gone were the days when you say, oh, your test is normal, that's fine, go back home. Um, advice should be given on how you should advice should be given to tell you how you should improve your current condition, irrespective of where you are at that point in time. Um, and it is actually very cost saving. um, early detection of disease is cheaper than treating the disease itself. Um, for example, cancer. If you catch cancer at a very early stage, then first and foremost, the most important thing is easily treatable. You can even cure it, as opposed to catching it at a very late stage. Number two is, of course, the cost. Yeah. So if you um, do your medical checkup, you find out that you have diabetes, high blood pressure. These can be treated. But if you don't, and you have these diseases, the next thing you know, you might have a heart attack or you might have a stroke. And treating this with angioplasty, angiograms, and will cost a lot of money. Yeah. So in the long run, it's better for you to do your medical checkup yearly to prevent these things from happening. Okay. You can imagine my wife's an oncologist, a cancer specialist, and cancer treatment is not cheap. Yeah. Sometimes one pill you swallow will cost you 4 or 5 thousand ringgit. Yeah, just by swallowing one pill. Yeah, so we can prevent that from happening. It would be great. So that is why health screening is actually very very important. So what actually is the main cause of death for us men? Now, in Malaysia, the main cause of death is still heart disease. Ischemic heart disease means a heart attack, okay, due to blockage of your arteries. So from 2010 to 2018, in fact, in 2020, it's gone even higher. This graph has gone higher and higher and higher, with a marked increase in 2018. There is another marked increase in 2019. Okay, not so much in 2020, but the trend is going up. So you can see the main cause of death in Malaysia, in both sexes, is still heart disease. So most people, when they talk about men's health, straight away people think about, oh, prostate cancer. Okay, but actually, if you talk about men's health, the most important thing that we need to put our hands on is actually heart diseases, yeah, heart attacks, strokes, and so forth, because that is the main killer in men. So this next slide shows the statistics on causes of death in Malaysia over 2020 last year. So the five principal cause of death in 2019, the first one is heart disease, yeah, 15%. Okay. Secondly, funnily enough, it's pneumonia. Pneumonia is a lung infection. The third cause is strokes, cerebrovascular disease, and then you have accidents, and then you have cancers of the lungs. Okay, so in men and in women, actually the main cause of death is still heart disease. But in men, have a look at the proportion, yeah, very, very high. Nearly 70% of death in men is due to ischemic heart disease. And if you go by age, when you are younger, your risk of dying is from transport accidents, okay? MVAs, motor vehicle accidents. But as you cross the 40 years of age mark, the principal cause of death would be heart disease, right? So if you are here, all you who are here today, if you are above 40, then your risk of death is probably be because of heart disease if you don't do anything about it, right? And it is in all ethnic groups, not only not in particular to one, yeah, Bumiputra, Chinese, Indians, okay, but Indians tend to have a lot more heart diseases as opposed to Chinese or Malays, probably because they have more diabetes than others. Diabetes is a very big risk factor to having heart disease. Okay, so from this statistic, we already know that, yes, we always talk about prostate cancers when you talk about men's health, but it is still heart disease is the first one. Okay, but all these things are preventable. You can prevent them. And one of the first things you should do is doing a health screening. Yeah. So again, if we look at percentage, ischemic heart disease is still the highest in both men and women in 2018 and 2019. Okay, so heart disease is the most, and then you have pneumonia, and then you have strokes, accidents, and also cancer. Yeah. So by doing medical checkup, by doing screening, you can catch this early. You can catch this early, and you can also catch this early. Okay. So doing medical checkups, preventative tests can actually help us reduce this death in the long run. Okay, so what does health screening involve? It involves these things: review of your medical history, physical examination, pre-screening discussion, laboratory testing, imaging, other tests, and post-screening discussions. I will discuss this one by one. Okay, to those of you who've had done health screening before, you might be familiar to this, but some of you might be skipping other things. Okay, you might not experience all of this that is on the screen. Okay, now this is how it should be done correctly, right? If you go and just pick one particular package, this might not be done to you. Okay, in my case, what I do is every patient I see who wants to do a medical checkup, they will not come with a package that they want. Okay, I will need to see them first. So I will review their medical history, ask about what their worries are, their past medical history, their parents, how are they? What are they? Are they well? Are they healthy? Any other diseases in the family? How's their social history? Do they sleep well? Are they stressed? What do they work as? Etc. So all those things I need to find out before I decide anything at all. Okay, and then I will do a thorough examination of the particular patient. We take your blood pressure, examine you, and so forth. So that's the first part. Yeah. So only after that, I will discuss with the patient in my pre-screening discussion what we should do. Okay, what test is actually suitable for you, because we're not going to do all the tests because it's a waste. So from the medical history, if I see that your family has a lot of heart problems, for example, then we will be focusing more on the heart. Okay, if your family has a lot of history of cancer, for example, then we try to move on. I'll be focusing more on cancer, for example. So it is actually very personalized. Okay, so further test is guided by this discussion. Some people, some patients, when they come in, they already know what they want, but sometimes what they want, it might not be right. Okay, I have patients who are worried about a skin problem, right? Discoloration of the skin, and they are worried that it's skin cancer. So they come for medical checkup. But when you ask their history, they smoke, and they have a variety of family history of lung cancer. So for that patient, he himself is worried about a skin cancer because his skin looks a bit more discolored than the rest. But to me, that's not a main problem. The main problem is, hey, you might be a high risk of getting lung cancer, for example. So we need to discuss this, and from then only we decide what test you need to do. So we don't do a one size fits all thingy. Okay, so a laboratory test is blood test. We will take blood samples. Blood samples are box standard. We usually check your blood count, your kidney function, your liver function, your cholesterol, your sugar. Those are quite basic ones. Okay, depending on your age and your history, then you might get a simpler set of tests or a more complicated set of tests in terms of your blood test. Okay, you will definitely get a urine sample to see if there's any bugs in your urine, any protein, any sugar, signs of diabetes, and so forth. Okay, if needs be, especially if you have history of colon cancer, you'll be asked for a fecal sample. Okay, you'll be asked to give a sample of your feces for us to send to the lab to search for blood. Yeah, because that's one of the main symptoms or main presentations of somebody with colon cancer. If you're a lady, you're also offered to do a pap smear, and cancer markers. Cancer markers are blood tests. Again, not everybody needs to do a cancer marker. If you are above a certain age, yes. And if you have a family history, yes. Okay. And cancer markers, again, are not conclusive. They are a blood test. They are not, if it's high, doesn't mean you have the cancer, but we need to do more tests. Okay. Please bear that in mind. Then after that, we do imaging. If needs be, X-rays to see your bones, to see your lungs, to see the size of your heart. We do an ultrasound scan. Okay, in ladies, it's very important. In men, also to have a look at your liver, your kidney, your bladder, right? We can see a lot of things with regards to the ultrasound. Okay, an MRI scan is not for everyone. If there is a very, very big suspicion that you might have something growing inside you from your history, or if I examine you, I find something inside, then I might order an MRI scan. Okay, that's not a routine thing. Again, a bone DEXA scan is this one here, where you go in that, where a scanner goes on top of you. That is usually to check if you have brittle bones, okay, osteoporosis, usually done for women who are postmenopausal. And you can sometimes also go for a heart scan, a coronary calcium scan, where they put you through a donut, and we can see if there's any deposits in your heart arteries that can be a sign of blockage in your arteries. Okay, so these are some of the imaging tests that you're not going to get them all. Again, it depends on the history and on the examination that I examine you for, and then we discuss what needs to be done. Okay. Other tests are the usual one: your vision test, your lung function test, where you blow into this piece of equipment here to have a look at your lung function. Some of you would have to do an exercise stress test, which you go on treadmill. We put leads on your chest and then you run. This can show signs of blockages in your artery. This would probably be something that I would advise most of us to do once you reach the age of 40. Because again, going back again, we know the biggest killer of men in Malaysia is ischemic heart disease, is heart attacks. So once you are 40, you should have an exercise stress test, just as a baseline to see if you have anything at all, right? And of course, you need to do your body weight and fat analyzer. So you go on these machines. Again, not many places do this. This machine can tell me how much fat you have in your body. It not only tells me your weight, it tells me whether you have a lot of fat or you don't have a lot of fat, right? So if you have a lot of fat, not good news. So if you're a lady, a mammogram is advisable after you reach a certain age or a certain condition. Yeah. Okay. The most important thing is after all this test is done, you have a post-screening discussion. What's the post-screening discussion? When all your test is back, we discuss with you your what is found. Right? The doctor should explain to you what is found in terms and ways that you understand. Okay. Your medical report will be discussed irrespective of whether this is the way how I do it, yeah, irrespective of whether there is anything found or not. Because to me, I always feel that there's always room for improvement. Okay, if you score 90 on your medical report, you can always do something to have to become 95, right? If you are 60, of course you need it to go up. But if you are 90 or 95, there's room for you to improve. Gone were the days where you just, if it's normal, the doctor gives you, okay, all your tests today is normal. Back again next year. So again, it's very important for you, if you do medical checkup, try to do it at one place, because they will have the report. Because it's always a comparison between your current medical report and the ones you do previously. If you hop around, it's a bit difficult, because when you do it this year, they might not have the results of last year, and you might not know where you kept the results from last year. So you can't really compare. Yeah. So it's actually a comparison most of the time from your previous medical report or medical checkup. Okay, so recommendations will be made on how to make you healthier. That's extremely important. So, who should go for health screening? Is it for everybody? It's not for everyone. Yeah. So obviously, if you're a child, if you have children, then they are not advised to go for a medical checkup except they have high risk of something. Okay. If they are born with a certain genetic problem, yes, they might need a medical checkup. But usually, it's very, very rare that you do a medical checkup on a child. Okay. You don't do a medical checkup on a child uh, kind of predict whether they can have something because the child himself or herself is not fully developed yet. Okay, so it's not a great point to do it. Now, in patients with concomitant disease means if you are already sick, okay, you already have cancer, you already have heart disease, should you do a medical checkup? Okay, the short answer to that is yes, because if you have cancer, it is treated. That doesn't mean you don't have a risk of having heart disease. So you will still need to be screened or you still need to be checked for other diseases that you might develop to have. Okay. So again, on the other way around, if you have heart disease or you're already treated by a cardiologist, that doesn't mean you don't need to have your health screening medical checkup because you might be exposed or you might be at risk of developing cancer, for example. Yeah. So even if you have concomitant disease, you might still need to do your medical checkup. So it's very important. So for those with high risk, you are definitely advised to do a medical checkup or health screening. If you have a family history of chronic disease, so if any of your family members, or especially your parents, your relatives have high blood pressure, high cholesterol, diabetes, heart problems, or cancer, then yes, you should be doing your medical checkup at least yearly after a certain age. Yeah, but once you are 30, you will need to be doing a medical checkup already because you are high risk. If you have, if your family members have any of this, then your risk of having it would be high as well. So we need to be on a lookout for these problems if you have them. Okay, sorry if your family has them. Okay, so not only family history, if you are at high risk of developing the disease due to genetics, okay, some diseases are passed down, okay, gene wise. Okay? Certain breast cancer, for example, um, certain genetically diseased, for example, thalassemia, for example, can be passed down genetically. So if your family has those, you need to have a medical checkup. Again, your lifestyle. If you have a very poor lifestyle, okay, you don't exercise, you lead a very poor lifestyle, you don't eat very well, you don't watch after your diet, you're stressed, your nature of work, you work long hours, you work at night, you work in a place where there's a lot of pollution, asbestos, all that makes you again a high risk of developing certain diseases. And because of that, you're at high risk and you should be doing a medical checkup. You should be doing a medical checkup, okay? Um, if you're above 40 years old, then definitely you should be doing a medical checkup. Nowadays, I even advise my patients to come in at even the age of 30. Yeah, of course, when you're at the age of 30, you don't need to do all those big tests that we do. Just a basic blood test actually would suffice. But of course, it again depends on what we find on your medical history and examination. Yeah. So, how often should you do a medical checkup? There is no specific time frame on when should go for health screening. Okay. So it depends on your age, your risk factor, and the advice of the doctor. If you have a lot of risk factors like we discussed just now, then you probably need to do it every year, especially after you're at the age of 40. Okay. If you're at the age of 30 and you do your medical checkup and everything is fine, then you probably don't need to do it every year, once every 2 or 3 years, okay, until you reach the age of 40. And again, if you're at the age of 40 and you are well, you might not need to do it every year. Okay? And every year also your medical checkup differs. So for example, if you had your cancer markers done the last time, you don't need to do it again this year. Right? And again, it is actually very, very personalized, dependent on your age, your risk factor, and also your attending doctor. That's why it's very important for the doctor to, for you to know the doctor and the doctor to know your family history and your previous medical records. Okay. So over 40 years old, it should be yearly. So it's less than, if you're less than 40 years old, it should be around every 2 years or so. Okay, but again, that depends on what the doctor finds when you are having the medical checkup. If there is something found at that point, then you might need to do it every year to monitor something, for example. But if you are fine, you are fit, you're healthy, maybe it's even every 3 years, maybe. Okay, it doesn't even need to be every 2 years. Okay, those are the points. Okay, so I think we've gone through all that is needed to be to know with regards to medical checkup. Um, Again, just remind you that it is actually your heart disease is actually the main cause of concern here, yeah, irrespective of sex. Um, it's Men's Health Week. Sometimes we do talk about prostate. Prostate is a problem, not as it's not even the top five killers as you see in the graph shown you before, yeah. But it's certainly something that you need to look out for, especially as you get older. Okay, just a brief lookout if you have symptoms passing water, difficulty passing water, you find that the flow is not as strong as it was before. Uh, you find that you need to go to the toilet more frequently, then those are signs of prostatism and that needs to be checked out. Okay, I'm not, I'm not, I'm not belittling the prostate, although it's a very little organ. But I think there are other things that we as men need to look out for when we talk about